Hey y'all, my name is Dr. Becky. I am a pelvic floor physical therapist at Genesis PT and Wellness, and today I'm going to talk about diastasis recti or DR. So, DR is very commonly seen in our postpartum population. All it is a stretching or a lengthening of the tissue that connects one side of your abdominal muscles to the other side. So it's kind of like a tendon. It's called your linea alba, and it goes down vertically the length of your belly between your left abdominals and your right abdominals. And what happens is in 100% of pregnancies, towards the end of pregnancy, and then in those early postpartum weeks, 100% of us are going to have a true DR if we were to be tested. What does that mean? That means that by the textbook definition, we have a gap of greater than 2 centimeters between the left and the right abdominal muscles. That is necessary. We have to have that tissue to stretch for our belly to grow and accommodate baby, right? Where we start to see patients for this in the clinic is when that 2 centimeter or more gap persists past about 6 weeks. Now, there's nothing magic that happens at 6 weeks. It's just that for the most part, we do see this DR spontaneously resolve. All that means is resolve on its own without intervention by about 6 weeks in most women. If it doesn't, that just tells us that there's some other movement pattern things going on, some pressure management things going on that we can address to allow your diastasis to heal itself. So let's talk a little bit more about what it is and what it isn't. So again, like I said, all it is the linea alba stretching or thinning or becoming a little more lax, if you will, between the two sides of the abdominal wall. Traditionally, diastasis is thought of as the gap, right? Oh, if it's wider than 2 centimeters, you have a diastasis. And while that could be true per textbook, a lot more research has been coming out over the years that the gap is actually the least important part of DR. And it actually shouldn't always be our goal to fully close the gap. Because if you think of like a rubber band being stretched, which here's our abdominal muscles, I'm going to open or widen the gap, and that tension in the rubber band is going to actually be pulled more taut. Okay, the whole point of the linea alba, the point of our abdominal wall, is to create tension to support our organs, to support our spine through movement, all the things. So tension is not a bad thing. If we are only focused on closing the gap, think of that rubber band kind of becoming more and more lax as we close the sides. Okay, that's not the goal with the abdominal wall. So what's coming out more and more is we actually care more about the depth of the gap itself. So how deep can I sink my fingers into it? We care about what does that feel like? Is it real mushy? Is it kind of firm, but I can still get kind of like deep in there? What happens just at rest? What happens when we add some leg movement? What happens when they do a crunch? What happens when they do a deadlift? All of these things your pelvic floor therapist should be assessing if you have complaints of DR and if you are wanting to get back to activity or fitness. Because what we know about any tendinous injury, which diastasis recti is basically, it's a tendon that's been like overstretched, over lengthened. What we know is we have to load it. So loading basically just means add weight, challenge, strength train, all the things. We also know that traditional DR exercises, which tend to have you laying on your back, being like doing a focused kind of core engagement, wrap your core, those have become pretty outdated. And we now know that what works better for healing DR, which again, healing DR means improving the tension and the depth, not necessarily the width of the gap. So what works best for healing DR and improving the tension there of the abdominal wall is to globally strengthen your core. Your core is your abdominals, it's your pelvic floor, it's your diaphragm muscle, and it's your glutes, and it's your lower back muscles, and then some connective tissue that's wrapped up in there. And we do that by loading the body. We do that by rotation. We do that by anti-rotation. We do that by overhead pressing. We do that by squats, lunges, deadlifts, all the planking, all the things. And that is going to, over time, be best for your DR. Now, all that being said, I am not saying, oh, you have DR, great, go do a full strength training workout with no consideration whatsoever. Don't get it looked at by a pelvic floor therapist. Like, blah, blah, blah. That is not what I'm saying. What I am saying, though, is that global strengthening is our end goal to heal DR. Now, in the interim, things that can help you while you are strength training, if you know that you have DR, is learning how to breathe with your diaphragm, learning how to properly engage your core, which does not look like, oh, I'm going to lay on my back and squeeze my abs. It looks like learning proper functional movement patterns, like how to hinge, how to squat, how to press, how to hold a plank, all of those things, and doing it while learning what that looks like to manage your inner abdominal pressures. And so that's kind of the golden ticket when it comes to DR and healing it. And it's very nuanced. It's very kind of dependent on the person. I understand that. But my goal is to decrease generalized fear around DR, decrease fear that you're going to make it worse if you see a gap, if you see doming, if you see dipping. You're not going to make anything worse because you're aware of it. And let's kind of figure out where that line is to where we can push your body up to its limit, where we might start to see some of those things. And then let's back off just a little bit and train in that zone so that way we can strengthen the tissues. That's the name of the game for every sort of tendinous injury, if you will. So hopefully that's helpful, kind of demystifying DR a little bit and explaining what it is, what it isn't, what our goal is with DR, what our goal is not with DR, how do we get to the end goal, how do we get there, and kind of how you shouldn't really be afraid of it. Reach out for help from a pelvic floor therapist if you have it or if you think you have it and you want to stay active, because again, that's how we're going to heal it, is by getting stronger and being active and all the things. So yeah, let me know what you think. Give me any questions that you might have in the comments and I will do my best to help.